Hello, my name is Brittany Marshall. I'm going to be doing my postpartum assessment now. I do not have a patient, so I will just verbally state it. I will ensure patient safety, dignity, and privacy as I enter the room, ensuring that I knock and wait for a parent to allow me in. I will then clean my hands, come in, and introduce myself to mother if she does not know who I am. I'm going to communicate using age appropriate and educational appropriate terminology according to what I have assessed as parents' understanding educational level. So we need to ensure that we have a good birth history and that I know the birth history. Was it vaginal, C-section? Were there complications? Is this mother's first baby? Does she have other babies? We have already established that vital signs are within normal limits. That's blood pressure, heart rate, temperature, and respiratory rate. Obviously, hemorrhage is a big concern after birth, which we want to keep an eye on. We're going to start with our BUBBLE acronym. The first B is breasts. If mother's breastfeeding or not breastfeeding, we need to assess the breast regardless, and we need to teach mother depending on what she is going to do. If she's going to breastfeed, we need to ensure that she appropriately knows how to breastfeed, and we need to assess the nipples for any trauma or any soreness, any mastitis. We want to ensure that we are quickly getting these things, and as a student that is my responsibility to do as well. We want to ensure that baby is latching okay, and we want to do that in a comfortable manner. We shouldn't just go up and be grabbing women's breasts. We should be doing it in a timely fashion and make sure that everyone is comfortable in the situation. If mother is not breastfeeding, we need to ensure that she knows not to take a hot shower with breasts facing the water. We need to have a tight support bra 24 hours a day, and we need to ensure that we do not touch breasts to stimulate them. That includes the nurses and the doctors, and that also includes their significant other. Next, we're going to go down to the uterus. We're going to have the hand at the belly button and the other hand at the pubic bone, and we are going to feel the fundus. It should be 1 finger length above the belly button per day until it reaches its top. It should feel hard. It should not feel boggy. If it feels boggy and loose at any point, we need to help mom with massage until it starts feeling hard, because boggy is a concern for hemorrhage. If everything is good with the uterus, we're going to go down to the bladder. We want to make sure we don't have a distended bladder that can really affect the uterus. We need to check urine output, how much is she going, and all of those things. We need to keep a chart of that. Bowels, has she had a bowel movement since birth, simply. Next, we're going to assess lochia. This is very important. There are different types of lochia, and we want to make sure that she's going in that specific order and not starting, getting to serosa and then going back to rubra. We need to, be very cautious of these things. If mom is 1 pad per hour is completely filled up with blood, that's a concern, and we need to, inform the nurse and the doctor that something needs to be done. Episiotomy / perineum tear. We really don't recommend that parents get episiotomies anymore, or that mothers get episiotomies anymore. But we will assess the site if it does, or if mother has a C-section, we will also assess the site with the RITA acronym. So redness, inflammation, tenderness, and approximation. Also, we're going to assist her with perineum, getting the perineum pads, the pads, the tucks, you can get them at the store, put them in the freezer, put them down there, help mom clean with the perineal wash, just assisting her and understanding that she's uncomfortable and that she might feel awkward about it, and that we're here to help her. Even as students, we are here to assist her. Next, we're going to go down to the Homan sign. We no longer do the bend the leg backwards like we were taught in LPN school. Now all we do is we just look at the legs and see is there any pain with movement. Next, very big is the we've gone on to the her of the bubble her, please excuse me. So the E is the emotional status. How does mom look? Does she appear depressed? Does she seem happy? Is she holding baby? Is she breastfeeding appropriately? Does she seem distant? Is the baby sitting over in the corner and everyone else is taking care of the baby except mom? If so, we need to, look at these red flags and start them now before we wait a couple weeks and she possibly is suffering from postpartum depression and is doing who knows what. Next, we're going to do ROGAM, and I was told just to say ROGAM. All done.